Okay. I feel like it's a lot of background noise. This should be okay. Hello to everyone, and welcome to your course introduction for practicum 6531. I am your clinical instructor, Dr. Sheila Fels, a family nurse practitioner. There we go. So I have been with Walden University since 2018. I have been a family nurse practitioner for over 20 years. My love is adults, geriatrics, and diabetes. I do have my own clinical practice. I do house calls, telehealth. I want to consider myself a traveling NP. I travel to homes. I'm a psychiatric provider with the city jail. I have virtual assistants for $6 an hour who are game changers for you. I teach you how to start a medical practice with $0 overhead, how to lose 10 pounds in 10 days. I do weight loss in my clinic. I teach you how to do your own credentialing, coding, and billing. And I'm also teaching chronic care management now. That's a work from home job where you can get paid by the government. So this is your chain of command. You have a program. No, you start at the bottom. You have the clinical supervisor for each department. Your practicum coordinator is Dr. Jamie Sherrup. F&P coordinator, Jennifer Stone. AGPCNP coordinator, Christine Abbott. And the entire program director is Dr. Judy Couric. Please follow your chain of command if you have any concerns. That would be starting with me. So make sure you review your syllabus, review your course calendar, review your rubric, and read and follow instructions. If you do those things, you will do well in this course. If you do not follow instructions, you will not do well. It's just that simple. Make sure you have extra devices, your computers. You all computers like to go dead. Matter of fact, I had one down me today. No longer any good. So always make sure you have extra available or extra funds if needed for you to go buy extra equipment. This course is 11 weeks, so plan ahead. Code of conduct: do not cheat, do not copy, do not lie. Watch what you say on social media. The faculty can see those things. And watch what you say because you're graduating from Walden University. And if you're speaking bad about it, other people see it and is wondering, should we even hire these students that come from Walden University? They talk trash about their entire training. So watch what you say on your social media. Best way to contact me is the university email. You're supposed to be using your Walden email. That's my telephone number. Please text me if you are going to call me. And you can schedule a time with me if you have any questions or concerns. Check your weekly announcements. I do post announcements on the first day of the week, whatever your first day is, Sunday or Monday. I try to post the announcements. The verification form was emailed to you. Make sure you post that you have that you did read that PowerPoint by Dr. Jennifer Stone. Late assignments, it won't even let me say it, will receive a grade reduction of up to 20%, and after 5 days may not be graded, and that's even with approval. Expectations must be met. I have never changed this slide. I kept this slide in from whenever, and it still applies today. Expectations must be met, so stay ahead where you do not get behind. Plan for me to grade your assignments within 10 calendar days of the due date. Feedback is usually in your assignments in the grades and or in the rubric. This, you need a C to pass this course. This is separate from your didactic. Your practicum, it is rounded up at the end, but you have to have a C to pass this course and a B to graduate. Make sure you post your introductions, do the practicum knowledge that you reviewed, the practical manual, clinicals. This is important. This is going to be your hands-on learning to learn all that you can. That's going to make you a better practitioner. Always be professional. Like I said, this is a graded course. It's not just satisfactory or unsatisfactory. Know what your requirements are. So the announcement, it says you're not supposed to start on 1. You can start on day 2, which was Tuesday. You are not required to start on day 2. If you are not ready, you start when you are ready. Just know what your final requirements are. You are to submit your calendar and post it in Canvas. You have assignments about the clinical skills and procedures form that is just for your benefit. And you're going to log your patients and your time if you see patients. If you do not see patients, there is nothing for you to log. Be professional depending on your practice. You're in a practice that wears scrubs. You're allowed to wear scrubs with your lab coat. You are no longer the nurse. You're no longer the hired help. So differentiate yourselves from other staff members. Have your name tag, have the equipment that you need, have your own personal protective equipment. If it's a mask, if it's gloves, if needed, you need to bring it. Nothing wrong with having references and resources on your cell phone. Don't make it look like you just always on your cell phone. Your requirements are 160 hours and at least 120 patients. Now, it used to be FNP were only to see 18 and older. I guess that has changed, that everybody can see age 13 and older. Your soap note cannot be soap note has to be on 13 and older. Or 18 and older. Let me look. Shadowing, only 8 hours can be counted. That's why we want you to be hands-on. You don't need to be shadowing for 3 and 4 weeks. So what should your first day at clinicals look like? You're going to introduce yourself to the staff. You're going to be confident, be ready to learn, find out what the bathrooms are, the break rooms, what computers you are allowed to use, if they allow you. Have access to the electronic medical records. How do the breaks and lunches work, if they allow that. And evaluate your population. Notice if you're seeing mostly pediatrics, so be looking out that, hey, am I going to be able to meet my patient requirements? Notice if you only see sinus and cold all the time and those chronic conditions, be aware of that. So usually you progress during your clinicals. You're going to start out shadowing, getting familiar with your patient population and the way that your preceptors assess their patients. You'll go in, listen at their speech and their flow. Then you may start out asking the questions. Then you may eventually advance to a physical exam. The preceptor will go with you initially, and then maybe you eventually get to do it on your own. Each preceptor has different expectations or how they do their clinicals with their students. In the end, you will be able to complete a history and physical. And be able to report off to your preceptor. So you're going to aim for patients that you have been studying for that week, because you're going to read all about it and learn all that you need to know. Sinus and colds are usually easier. When you get into hypertension and diabetes, it can be more complicated. Musculoskeletal and neuro can be more in-depth. COVID, limit your contact, your exposure. Make sure you have your PPE PPE equipment. We are doing focused examinations. You're going to ask pertinent questions related to the chief complaint. Let you all think about that for a minute. And always assess respiratory and cardiac. So for sinus, you look in the ears, you're palpating the sinuses, shortness of breath. You're doing, if somebody has shortness of breath and chest pain, it's a focused exam, but your cardiac and respiratory sections are going to be comprehensive. If it's low back pain, but if it's headache. Grand rounds, I'm assuming it will be done again. The scheduling your announcements is nothing for you to do. It's like you can be interactive about different case studies. And a link will be available for 2 weeks after the recording. It's supposed to be fun, interactive. Your hours are supposed to be completed by week 10. Of course, not before week 6. If you do need more time, you can request it. No more telehealth for you guys. We providers are still, they extended our telehealth patients. Meditread, do not get behind. You are logging a brief synopsis of your patient. So you're keeping it simple. This is the things that are supposed to go in Meditread. It's in your practicum manual, where I got this from. A brief synopsis of the patient, not a soap note. Your preceptors are going to sign off on your hours. I do not sign off on hours until your preceptor does. Oh, it may take several weeks for them to even get access to Meditread. If they don't have access by week 3, you can let me know. They're going to complete their midterm evaluation and the final evaluation in Meditread. Soap notes, bills 13 and older. You're going to submit at the same time 2 copies of your soap notes. One is going to be where your preceptor initials each page and signs the final page, and you're going to submit a Word document that is graded. And you do not have to grade your soap note. They are just verifying that it is the actual patient that you saw in the clinic. You must achieve a score of 70% on at least 2 out of 3 of your soap notes. Soap notes are in weeks 3, 6, and 9 on the designated topic. Soap is subjective, objective, assessment plan, and reflection notes. Subjective is what they tell you. Objective is what you observe. Assessment are your diagnoses. And plan is what you are going to do and why you are doing it. Why are you giving 500 milligrams instead of 250 milligrams? History, all of this plus some. If it's pertinent, chief complaint, history of present illness, past medical history, family history, social history, and review of systems. HPI tells the story of the patient. It's like your report off to another provider. You're going to do pertinent, positives, and negatives. Differential diagnoses, have at least 3 and include ICD-10 code. Always consider what labs and tests have been done. Have at least 3 references for your soap notes. I'm just amazed that I say all of this stuff. It doesn't get done. As far as soap notes, I have a busy practice. I'm probably, I can't even tell you, 1,000 charts behind. When I got my virtual assistant, she is able to go in and complete a full soap note for me. And I was amazed. I said, wow, no medical background. And she completed a soap note. But for some reason, my nurse practitioners can't. We're going to work on that. History of present illness. Cover all factors. Preceptors, I will have a minimum of 3 contacts with your preceptor. I will email them the first contact, and then we'll complete our midterm conference call. There's nothing for you to do for the first contact. Midterm evaluations, it is virtual, face-to-face, either Zoom, FaceTime is Apple, iPhone, Duo Meet is the other devices, Android. You do not have to be present. Your preceptor can schedule it, or you can assist your preceptor in scheduling it around week 4. I only want to talk with one preceptor. Woo! Any questions? I gave all the info. So you're going to have a great quarter. Learn a lot, do a lot. Don't focus on all those procedures on that form. That's throughout your practice, throughout your whole time at law, not just this quarter. Okay. Well, thank you for joining in. Have a good night. Mm-mm.